I appreciate the opportunity to share with you, our experience with your company. It's been, we've now, I guess it's been basically a year since we started the installation, and with the progress and all the things, the commissioning of the system, and so, overall, it's been a great experience. As with any system, you're going to have opportunities to improve it. Maybe change the way that you operate it, and there were some things I know that through the process we created in our own, the way we operated the system. But from the pass-through technology that we've used on this project, we have a 7-story tower, and we'd had some dumbwaiters that were failing. And in the process of this project, we were able to get rid of one of those dumbwaiters, which saved us probably about $80,000 of money that we would have had to put into a dumbwaiter, remod and upfit. And we were able to eliminate that in the process because our pharmacy had used that for transporting medications throughout the building. And this technology allowed us, because of the ability of the canister to go through the station, it actually made it easier for us to pipe it. And we did a single run pipe. So that was some really good savings on our part for that. From a standpoint of low voltage wiring, we thought it was neat that the wiring did not run separately, that it actually ran with the piping. Which makes it easier to troubleshoot if you had to troubleshoot the wiring. And it keeps it nice and neat. I mean, you don't have this stray wire hanging or running some other course through the building. And with wire management and Joint Commission and CMS looking at that, it was really a good way for us to go with your system. One of the other things we thought was really a challenge on our job was the fact that we were a 7-story building, and we had to come up with a way to create a fire rating through the building, and we were able to accomplish that through this project. And it took both teams working together. It was a major concern, but Aerocom came aboard. They was with us. They went through the struggle with us on it, and we got through it, and really made a good product at the end. Because firewall penetrations are extremely important to us. We manage that, and with Aerocom we didn't have a problem. Any penetration they made, they fire caulked, they sealed, and went back behind themselves. A lot of times they did it as they went through the firewall. So just a good operation. The techs were great. I have to say that from the beginning of the project to the end of the project, all they were was about customer service and helping us come out with a good product. And not only from an engineering standpoint from my team, but also the end user. There was a lot of education that went on. We're willing to come in on off shifts anytime that we needed training done. That was accomplished. And I think it really helped with our staff understanding how to use the system. Some of the other good things I think that went into the product was the placement of the diverters. I think there was a lot of thought in where those diverters could go in our organization. If you're a facility manager of a hospital, you know as well as I do that the ceiling spaces are extremely limited, and Aerocom was very competent in the way they ran the pipe. Probably one of the best installations I've seen. The diverters were placed in a way that we could get to them if we had to service them, or if Aerocom had to come back and service them. So diverter placement, piping. We have a couple areas in our hospital that are so tight. I really don't know how they got the piping through it, but they did an excellent job in performing that work, and we really didn't have any complaints from our end users or from the people that were in the areas where they were working. It seemed they always abided by the hospital's infection control measures, and did a really good job on that. One of the things that arose in this project was that the hospital wanted some manageable way to know who got the medication. And through the project, we were able to work through that. We had an existing security system that we wanted to manage the card access. We wanted to use our badges, and we were able to do that with Aerocom's help. And it's worked really well. Our director of pharmacy and our director of security both are very satisfied with the way we set it up and the way that they're able to go back and track who had custody of that medication or pharmaceutical. From a carrier standpoint, we had a few challenges on the carriers, but we were able to work out and standardize the carriers that really fit our need, fit our culture, and those have worked extremely well. As an organization, we've had other providers of pneumatic tube systems here at the hospital, but I have to say that they don't even compare to the product that we've got from Aerocom. We fought for a number of years with one system, which was a point-to-point, and that point-to-point system, we had to buy carriers about every 3 months. Since the installation of this system, we've not bought the first carrier, and we've made over 100,000 transactions on the system. So extremely pleased and happy with the quality of the carriers and the quality of the pipe run, because the pipe runs, if they weren't made, the connections weren't made smooth, we'd be having trouble with the carriers. From a service standpoint, I can't give them anything but a 10. Whenever we've needed them, they've been here. They've been responsive. I don't only have them at this facility, but we built a new hospital in Greensboro, Georgia, and they're just as satisfied. The installation there was excellent. So I can't say enough good things about Aerocom. When we were looking for a system, we looked at all the probably about 4 or 5 different pneumatic tube companies, went out and looked at some installations, and hands down the pharmacy director and myself both felt that Aerocom offered the best product for the best price, and we were totally satisfied. So warranty issues, we've had great experience with them on a warranty. Anything that's come up, which hasn't been much, they've been there with us, beside us, and helped us through it. So to Ron and his team, I thank them for a good end result. If you're looking for a tube system, Aerocom's who you need to get.